Assalamualaikum and hi to our lecturer, Dr. Ahmad Syibli bin Othman. Today, we will present about the Health Informatics Group assignment entitled The Application of Social Media Tools in Health Informatics Perspective during COVID-19 Incidents in Malaysia. We will discuss in detail what is social media, the components of social media tools, the government's roles, healthcare providers' roles, health professionals and educators' roles, individuals' roles, challenges and solutions, and also the conclusion of our discussion topic today. So, what is social media? It is a Web 2.0 based platform where users can contribute to the content, share and consume content generated mainly by other users, in which it can facilitate people's communication to interchange knowledge more effectively, especially in healthcare conversation. During COVID-19 outbreak in Malaysia, the percentage number of social media users had increased by 7% or 2 million of the total population compared to the year 2020, making the total of country's social media users approximately 86% of the total population in January 2021 due to the current pandemic situation and implementation of MCO. There are several components of social media tools that are usually used by social media users in Malaysia, especially during COVID-19 outbreak, such as social networking like Facebook are using newsfeed function to direct users to the WHO websites and websites of local health authorities. The second one is blogging and wikis by accessing medical journals and Wikipedia about COVID-19 information. The third one is microblogging, such as Twitter, that are usually used by individuals for searching latest news of COVID-19 from reliable sources. Next is social bookmarking like Pinterest by promoting visual content that fight against COVID-19 misinformation. And lastly, video sharing such as YouTube that are used by government and healthcare professionals to disseminate accurate information and implement public health strategy by capturing a wider audience from all demographic backgrounds. So due to COVID-19 pandemic, the use and dependence upon social media platform become increased because many countries, including Malaysia, had decided to manage this outbreak through physical distancing strategies. Therefore, by assessing the role of government, healthcare provider, healthcare educators, and also individual itself are very important in making social media as a platform where social media users can get quick access to the latest information and news about the COVID-19 incidents in Malaysia.
I am Iman Zulaikha and I will be presenting application of social media tools during COVID-19 from government's perspective. First of all, social media can act as influence to government. Social media act as a tool to gather information through online to explain human behavior. In this case, social media can provide an accurate prediction of disease outbreak case count. Demographic and geographic data obtained from social media can inform medical researchers and practitioners about the characteristics of people who are at risk of being infected. Social media posts through Twitter and Facebook can provide insights into public's cognitive and behavioral responses to health-related issues, thus suggesting ways for the government in handling public response. Aside from that, social media tools may help the government in disseminating health information and combat misinformation that may arise from the public. Through social media, the government are able to inform the public about current health topics, such as healthy way of living during pandemic or the immunization program. It is also helpful in communicating the risk of disease outbreaks by reminding the public. Government are also able to provide instructions about prevention behaviors to a broad audience through online. By utilizing social media, the government can increase their effort to monitor and enforce fact-checking dubious information on social media, promote strategic and timely refutation on misinformation, and give out reliable information to assist the public. Once, the public used to believe that by sniffing cloves vapor, one can heal their COVID-19 symptoms. Social media tools makes health interventions by the government reachable to the public. Social media can offer health resources, including delivering health information to audiences such as vaccination programs. Social media is useful to the government in combating COVID-19 by developing apps such as MySejahtera to assist in managing the COVID-19 outbreaks in the country. Users can monitor their health progress throughout the COVID-19 outbreak. MySejahtera enables the Ministry of Health to monitor users' health conditions and take immediate actions in providing the treatments required.
Hi, I am Nesalata Gunasekaran, and my part is about the health provider's role in the application of social media tools during the COVID-19 incidents from the Health of Health Informatics in Malaysia. Healthcare providers are doctors, medical specialists, and nurses who work in a hospital setting. During the COVID-19 incidents, the MySejahtera app has been developed by the Ministry of Health to connect between the doctors and the non-COVID patients as well as the Malaysian public, despite the movement control order, quarantines, and various non-pharmacological measures. It also contains many useful features that assist COVID or non-COVID patients to get reliable and faster access to health providers. This enhances the doctor-patient relationship as well as empowering patient support. As you can see on your right, there is a MySejahtera screenshot that contains various features. One of the features is the self-report of COVID-19 test. As you can see here, people at home can do self-testing and report the results or update the results directly in the COVID-19 self-report section through the MySejahtera app. Patients or close contacts can also get information on self-test kits such as Neurogen, and they can also purchase online those self-test kits during the COVID-19 incidents. Another great feature is the health screening facility in which patients or those who are at higher risk can also locate health screening facility in nearby through the MySejahtera app to screen their current health status. This helps them to better keep in check with their health. Another incredible feature is the digital healthcare feature in the MySejahtera app, which has the virtual health advisory like Doctor You. Doctor You is a feature in which people can ask doctor any question about their medical condition or medical status as well as to get medical prescription. While the clinic appointment booking features such as the System Janji Temu Clinic KKM and BookDoc is one of the great features for people to make online appointment booking of the clinic. During the COVID-19, we also get to know that there are many people who are facing depression due to loss of jobs and children who are unable to study because the schools and universities are closed for a long period of time. So the Minda Sihat feature is also included, like the emotional support hotline, in which patient or the people can call the phone number to get mental health support and also to reduce the depression and the stress due to the extended lockdowns. Another extensively used feature is the COVID-19 help desk during the past 2 years of the COVID-19 incidents. It is available to the public and the COVID-19 patients to get more details about their vaccinations, steps to carry out quarantine at home or quarantine at hospitals, risk status, as well as digital certificate information such as downloading the cert, booking for the next online appointment for the booster shot, or scanning the QR code. And the fifth feature here is the track COVID-19 hotspot, in which the immunosuppressive patients and the population who are at risk, for example, those with cancer and autoimmune diseases such as multiple sclerosis, can avoid COVID-19 hotspot places by identifying them through the hotspot icon in the MySejahtera app. And contact tracing can also be done via this app, which greatly helps them to reduce the infectivity of the virus.
Health professionals study, diagnose, treat, and prevent human illness, injury, and other physical and mental impairments in accordance with the needs of the population they serve. And the health educators teach people about behavior that promote wellness. They develop strategies to improve the well-being of individuals and community, especially during COVID-19 pandemic. The critical role of media is to keep people connected and well-informed. Whenever there is a COVID-19 outbreak, people tend to turn to the media for information. Thus, social media is used by the health professionals and educators to share update and current research about COVID-19. Many research papers updated in medical journals or websites that are accessible for the public. The professional can also organize a live forum session to share their findings about COVID-19 through Facebook and YouTube. Next, the health professionals and educators are responsible to change the bad perception about COVID-19 and vaccine. Unfortunately, the spread of scientific news by instant message technology creates a panic. Therefore, the experts need to step up to clarify the fake news by giving scientific findings using social media platforms such as Twitter and Facebook. Using social media can help to reach many people regardless of age. All the health professional researchers and educators may create an online scientific research communities where they can access to all COVID-19 research, reviews, commentary, news and analysis as it is published globally. The resource aims to assist cooperation to bring the COVID-19 pandemic to a close. The example is scientific research community and the platform used including PubMed, ResearchGate, and Google Scholar.
Hi, so I'll be presenting about the individual roles in managing or handling social media tools during this COVID-19 pandemic. So the first one is to make sure to share information from the trusted organizations only. So individuals must make sure that any infos related to the COVID-19 news or health informations are taken from reliable or trusted organizations only, such as the World Health Organization (WHO) or even Malaysia Ministry of Health Malaysia (MOH). So the next one is individual must also follow officials accounts or known accounts related to the authorities. So basically, individual must follow the officials account of Ministry of Health Malaysia (MOH) or even the Health Ministry YB Khairi Jamaluddin or even the Director General of Health DG Hisham. So this is for reliable and also authentic information about the COVID-19 news. Okay, so the third point is to individual must also get involved in any activities done by the government. So individuals can join activities such as watching lives from Ministry of Health Malaysia on FB and also Twitter for better understanding of the COVID-19 news rather than just reading their posts. So the last one or the fourth one point is individual must also report malicious comments or posts that could lead to wrongful information. So basically, individual must play roles in reporting comments or posts that are spreading false news so that it can be stopped from reaching a bigger audience.
For the first challenge is compliance. Many different regulations and policies to provide efficient patient care. Several healthcare professionals have disobeyed the regulation and been fired from their jobs and pressed with criminal charge. So for the solution, establish a standard that prohibits anyone from giving out information about a patient's health information or medical records on social media. Healthcare workers need to be aware of the balance between social media usage and the compliance. Next, fake news or misinformation. Finding accurate information on social media sometimes can be difficult in learning about infectious disease such as COVID-19. Increasing pandemic fears due to fake news and misinformation can be harmful to the population. Such as example, on October last year, the Minister of Health of Malaysia, Dr. Khairi Jamaluddin, in a tweet ordered the Ministry of Health to lodge a police report and a complaint to the MCMC for fake news against Twitter username Khalid for posting a video that listed school teachers who had died due to COVID-19 vaccines. So, for the solution, public health organizations must continually monitor the spread of inaccurate health information. Next, dispel myths by providing research-supported resources to the public. Also, invite patients to conversations about misinformation that they may encounter online. Next, professionalism. Physicians may need to maintain their professionalism with patients and colleagues. Being too personal or casual on social media could affect their credibility. Risk of providing misinformation or contributing to medical controversies. Solution: review the privacy settings on social media accounts regularly. Avoid posting online when emotional, exhausted, or under the influence. Should ensure patient confidentiality and must avoid sharing any identifiable patient's information. Next challenge is social media development. Use of videos in social media will be budgeted for ongoing maintenance and information technology support. Challenge in developing social media sites that can benefit patient engagement and information delivery. Collaboration between the health and digital media sectors. For the solution, first, providing further training to medical professionals to engage on social media, building patient satisfaction, improving better knowledge, and provide better customer service by handling customer complaints and concerns. Last but not least, increasing in usage lead to repeated exposure to media. Accessing COVID-related information is likely to cause increased levels of worry among the populations. Repeated exposure to media coverage of distressing events may be harmful. Huge volumes of new information being constantly repeated. So for the solution, first, make it clear what is to be done with the information. Make it easy for the user to take action. Keep things simple and clear. Also, provide balanced information and provide supporting information.
In conclusion, social media is very essential in the healthcare system. It allows the healthcare provider to raise public awareness on a particular disease. It also helps with public health surveillance, where healthcare practitioners may quantify changes in disease awareness as well as sentiments toward the treatment and preventative care. Moreover, social media also allows sharing of medical related information such as the most sought after disease such as diabetes and also cardiac disease. While the whole idea of social media is to connect with people, it allows people going through difficult time of disease to gain peer support from a group of society experiencing the same problem.